Welcome to On the Beat, everyone. I'm Troy Thompson, sitting here with Dr. Andy Barlow from Chiropractic Physician Centre of Tupelo. Now, Dr. Barlow is the author of the #1 new release book on Amazon, Licensed to Heal, What to Do When Traditional Medicine Has Failed. And today we're here talking all about brain health. Welcome to the show, buddy.
Thank you, Troy.
To see
Thanks
you
for having
again.
me.
I feel like you're my buddy because you give me such great information.
Well, thank
and I
you.
often think to myself when we finish the interviews, keep that in the back of your head, Troy. You never know what you're going to need as in information. So we
Absolutely.
appreciate you.
Thank you.
Today we're talking all about brain health. How do we know that our brain is in poor health?
Okay, that's a really good
Because
question.
I'll be honest, I forget half the things I'm talking about sometimes.
That would be
Does that
one
mean
of them.
poor brain health?
It could be. It could be. So, actually, when we start to have poor brain health, one of the symptoms, actually, there's 6 of them, but focus, attention, and concentration. So, what will happen is patients start to notice that they can't focus, like reading the newspaper or reading a book, and then they lose attention. Their attention span waxes and wanes, and then concentration. Now, those are really the first 3 symptoms of poor brain health. And then once they continue to degenerate, neurodegenerate is actually the proper name, we start to get depression, anxiety, and insomnia. And of those 6, the more of these you have, the more complex the neurological disorder that we have.
What are we doing to fix it? And how
Okay.
do we know we have it? Like everyone, a lot of people say, oh, I'm so depressed.
Right.
Well, that's not depression.
And so what happens too is you have patients who go to doctors that really don't understand it. They're trying to drug their way out of this problem. And so when you actually look at focus, attention, and concentration, most of my patients start to notice this at about the age of 40. And then they go to a doctor who doesn't really understand this, and they go, well, Troy, you're just getting older, so that's part of the aging process. And the scientific research just doesn't back that up. And so what happens is over decades, in America, we have this thing called the standard American diet, which is poor nutrition, okay? Fast foods, sodas. So we're putting these toxic substances in our body, and it's not giving our brain the substrate to actually regenerate itself and to maintain good health.
Well, how do we know what is good for good brain health?
Okay.
Food-wise.
Well, that's a good question. And one of the things that we have to do, we actually do metabolic testing to find out, in your instance, what may actually trigger some of these neurological disorders. So we would want to do a gluten test. We would want to look at blood sugar. Oh, and by the way, we've talked about in the past, like type 2 diabetes.
Yes.
And type 2 diabetes can cause numbness and tingling in our hands and our feet, but also type 3 diabetes is now known as dementia. So we know that having your blood sugar too high for too long can actually destroy your brain function.
Doctor, what makes your program unique to patients?
I think the one thing that makes us unique is that we are actually helping the whole body optimize its recovery. We're not just trying to treat a symptom. Okay, that's not our focus. Our focus is to do metabolic testing, which means do blood work to look at the whole body, find out what part is abnormally functioning, and then put a patient on a specific program that's tailor-made specifically for that individual. And we actually have therapies that actually help retrain the brain to optimize its function, retrain the body, and actually the brain through what's called neuroplasticity. It actually means that the brain actually has the ability to reconnect with itself and actually to heal itself.
Interesting.
Yes.
So we're not needing to do scans or anything like that?
Well, again, it's a possibility. You need to do those things because there may be some issues where you have, God forbid, a tumor or some type of micro trauma or mini stroke. Those things need to be ruled in or ruled out. So, I mean, I do refer patients out for those kind of scans if they've never had them.
After you do the blood work and things like that.
Yes.
Dr. Barlow, thank you so much.
Thank you.
We really appreciate it. If you want to find out more information, there it all is, everyone. Dr. Andy Barlow from Chiropractic Physician Centre of Tupelo. Back after this short break.